I have been doing this for a long time, treating patients, looking at scans, listening to people describe their pain. And one pattern keeps showing up that most people completely ignore. They come in and they tell me their back hurts every morning. Their neck is stiff. Their shoulders ache. They feel exhausted even after a full night of sleep. And the first thing they say is, I think I need a new mattress. Or maybe I'm getting older. Or maybe this is just how it is now. And I have to stop them right there. Because 9 times out of 10, the mattress is not the problem. Age is not the problem. The problem is something they do every single night for 8 hours, completely unconscious, and they have been doing it the same wrong way for 20, 30, sometimes 40 years. The problem is how they sleep. And before you think this doesn't apply to you, give me a few minutes, because most people who watch something like this think they already know what I'm going to say. They don't. The details matter. The small things matter. And it's usually one small thing that makes the entire difference between waking up feeling human or waking up feeling like your body spent the night being wrung out like a wet cloth. Let me start with something I want you to picture. Imagine taking your neck and slowly turning it to one side, not all the way, just enough to look over your shoulder. Now hold that position. Don't move. Keep holding it. 1 minute, 2 minutes. Now imagine holding that exact position for 7 hours straight. That is what stomach sleeping does to your neck every single night. One side of your neck is being stretched out. The muscles on that side are pulling, straining, being held at their limit for hours. The other side is being compressed. The joints on that side are jammed up, loaded, sitting in a position they were never designed to hold for that long. And your brain doesn't know this is happening because you're unconscious. You feel nothing in the moment, but your body knows. Your body is keeping score. And when you wake up and you can't turn your head to the left without wincing, when your neck feels like a tightly wound rope, when there's a dull throb right at the base of your skull, that is your body showing you the bill from the night before. But the neck is only the beginning. Think about where your weight is distributed when you are lying face down. Your belly, and I mean this anatomically, not as a criticism, your abdomen is one of the heaviest and softest parts of your body. When you lie face down, it sinks. It drops into the mattress. And when it drops, it pulls your lower back into an exaggerated arch. An arch that would be completely normal if you were standing and bending slightly backward. But you are not standing. You are locked in that position, completely still, unable to shift, for hours. The muscles in your lower back are not designed to stay in that contracted, compressed position through an entire night. They fatigue. They tighten. The small joints along your spine get loaded in a way that irritates them. The discs between your vertebrae are not getting the relief they need, and by morning, you feel it. That stiffness in your lower back when you first try to stand up. That hunched over shuffle to the bathroom because your spine just won't straighten out right away. That's not age. That's the position you chose last night. And there is one more thing about stomach sleeping that almost nobody talks about. When you are lying face down, the entire weight of your body is pressing down on your chest. Your rib cage is being compressed against the mattress from above by gravity and from below by the surface you're lying on. That means your lungs cannot fully expand. Your breathing for the entire night is shallow, restricted. Your body is not getting the deep, full breaths it needs during sleep. Oxygen exchange is reduced. Your nervous system cannot fully rest. Your body cannot fully recover. This is why you can sleep 9 hours on your stomach and still wake up feeling like you barely slept at all. It is not in your head. There is a physical reason, and it is completely fixable. Now, I want to talk about side sleeping because this is where most people end up, and most people do it in ways that are silently causing them problems they never connect back to their sleep position. Let me ask you something. Do you get pain on the outside of your hip? Not inside the joint, but on the outer part, sometimes running down the outside of your thigh? Do you wake up and one hip aches in a way that takes a while to ease off once you get moving? Does your lower back feel twisted when you first wake up, like something is pulled on one side? If any of that sounds familiar, stay with me. Because what I am about to explain is something most people spend years suffering through without ever understanding what is actually causing it. When you lie on your side and you stack your legs on top of each other without any support between them, your top leg is not floating in the air. It has weight. And that weight is pulling your pelvis downward. Your pelvis tilts. And when your pelvis tilts, it drags your lumbar spine with it. Your lower back ends up in a rotated, twisted position and stays there all night while you sleep completely unaware. At the same time, your knees are pressing directly into each other, joint against joint with no cushioning for hours. This is where that outer hip ache often comes from. The pressure on the joint, combined with the tension from the pelvis being pulled out of alignment, creates exactly the kind of chronic low-grade irritation that feels like it just appeared one day out of nowhere. It didn't appear out of nowhere. You created it slowly, one night at a time, over months or years. The fix is simple and it costs almost nothing. Take a pillow. Place it between your knees. That is it. When you do this, the weight of your top leg is supported. Your pelvis stays level. Your lower back is no longer being twisted, and your knees are no longer grinding into each other. I have had patients come back after 1 week of doing this and tell me the hip pain they had been managing for 2 years was almost completely gone. Not because I gave them medication, not because they had surgery, because they put a pillow between their knees. Now, let me talk about the pillow under your head, because this is where most people think they have it figured out and most people are wrong. The job of your pillow is one thing and one thing only: to keep your head in a straight line with the rest of your spine. That is the entire job. Not to be comfortable in a general sense, not to feel soft or luxurious. To hold your head in neutral alignment so that your neck muscles can actually rest instead of working all night to compensate for a bad angle. If your pillow is too thick, your head is pushed upward. Your neck bends toward your chest. Imagine looking slightly downward all night. The muscles at the back of your neck are stretched. The ones at the front are compressed. You wake up with tension at the base of your skull, sometimes a headache that sits right behind your eyes, and a neck that feels like it belongs to someone who worked a double shift. If your pillow is too thin, your head drops downward toward the mattress. Your neck bends the other direction. The muscles along the side and back of your neck are now being strained in the opposite way. Same result, different direction. What you need is a pillow height that matches the distance between your shoulder and the side of your head, because when you lie on your side, that gap needs to be filled. If it is not filled, your neck is sagging into that space all night. If it is overfilled, your neck is being pushed up and bent. The goal is straight, neutral, like your neck is simply a continuation of the rest of your spine with no bend in any direction. Here is something practical I tell my patients. If your pillow is slightly too thin, fold a bath towel and slide it underneath the pillow. You can add or remove folds until you find the height that feels truly neutral. This is not a complicated solution. It is a precise one, and precision is what your spine needs. Now, I want to address something that almost nobody talks about when it comes to side sleeping, and it is the area just below your rib cage, above your hip, your waist. Your shoulders are wide, your hips are wide, but your waist, the section in between, is narrower, which means when you lie on your side on a flat surface, your shoulders and hips are supported, but your waist is hanging in the air with nothing underneath it. And all night long, your lower back on the underside is being pulled down by gravity into that unsupported space. Take a thin, folded towel or a very flat pillow and slide it under your waist, right in that narrowed section between your lowest rib and the top of your hip. You will feel your lower back settle into a supported position almost immediately. The muscles there can finally relax because they no longer have to work to hold your spine up against gravity. This one adjustment alone has changed things dramatically for some of my most chronic low back pain patients. It is not glamorous. It is not complicated, but it works because it addresses a real mechanical problem with a real mechanical solution. Now let us talk about back sleeping. Because for many people, this is actually the best position for spinal health, but only when it is done correctly, and most people make 1 or 2 critical mistakes that turn a good position into a painful one. The single most common mistake I see with back sleepers is keeping the legs completely flat and straight throughout the night. Here is why this is a problem. When your legs are fully extended, the muscles along the front of your thighs, large, powerful muscles, are in a lengthened position, and in that lengthened position, they pull on the front of your pelvis. They tilt it forward, and when your pelvis tilts forward, your lower back arches up off the surface you're lying on. You can test this yourself. Lie flat on a firm floor and try to slide your hand underneath your lower back. You will likely find that there is significant space there. That space represents an arch in your spine that your muscles are working all night to maintain. Now bend your knees slightly. Put a pillow or a rolled blanket right behind your knees to support them in that slightly bent position. Feel what happens to your lower back. It drops. The arch reduces. The muscles that were pulling your pelvis forward relax because the tension on them has been released. Your spine settles into a much more neutral position. This single adjustment, a pillow under the knees, is one of the most powerful things a back sleeper can do. And yet almost nobody does it because nobody ever told them why it matters. For your pillow situation, when sleeping on your back, the calculation is slightly different than when sleeping on your side. When you are on your back, you are not trying to fill a shoulder-to-head gap. You are trying to support the natural curve of your neck without pushing your head too far forward. A pillow that is too thick when you are on your back pushes your chin down toward your chest. You end up sleeping in the same position as someone who has been staring at their phone for hours. The muscles at the back of your neck are stretched and straining all night. You wake up with tension headaches and a neck that aches at the base. A pillow that is too thin lets your head drop backward. Your throat is compressed. Your airway is slightly restricted. And the joints at the back of your neck are jammed together. Neither is what you want. What you want is a pillow that supports the curve of your neck, that natural inward curve, without forcing your head into any extreme position. One thing that works very well is taking a small hand towel, rolling it firmly, and placing it inside the lower section of your pillowcase, right where your neck rests. This gives targeted support to exactly the part of your neck that needs it most, while the rest of the pillow cradles your head in a comfortable position. Now I want to give you a few things you can do right before you get into bed tonight that will make a real difference in how you feel tomorrow morning. The first one takes about 45 seconds. Lie on your back on the floor or on your bed. Pull both knees up toward your chest. Hold them there with your arms wrapped gently around your shins. Now slowly rock from side to side. Small movements, gentle rocking. Do this for 30 seconds to a minute. What this does is release the accumulated tension in your lower back muscles that built up throughout the day from sitting, standing, walking, and carrying whatever load your day brought you. If you go to sleep without releasing this tension, those muscles stay tight through the night, and you wake up with them still tight in the morning. This simple movement gives them a chance to let go before you ask them to hold a sleeping position for the next several hours. The second thing I want to mention is for anyone who deals with that nagging ache on the outer side of the hip. Before bed, find a tennis ball or something similar. A firm ball, not too soft. Lie on your side on the floor, which is firmer than a mattress and works better for this. Place the ball under the muscle on the outside of your hip, not on the bone, on the soft tissue just above and slightly behind the hip joint. Let your weight sink slowly into the ball. And when you find a spot that produces that particular kind of discomfort that feels like pressure on something that needed pressure, hold it there. Don't roll around aggressively. Just stay on that spot and breathe. Give it 30 to 60 seconds. Let the muscle slowly release under the sustained pressure. This is called myofascial release, and it is something we use clinically, but you can do a version of it yourself at home with a ball that costs almost nothing. Done consistently before bed, it addresses the muscle tension that contributes to that outer hip pain before it has a chance to be aggravated further by however you sleep. The last thing I want to say is about food and your sleep position, because these two things interact more than people realize. If you eat a large meal within 2 hours of lying down, you are making every sleep position harder on your body. A full stomach sits heavily against your diaphragm when you are lying down, restricting how deeply your lungs can expand. If you sleep on your right side after a heavy meal, the anatomy of your digestive system means acid has an easier path back up into your esophagus. This is why people who deal with heartburn or acid reflux almost always have worse symptoms at night, and why the simple act of sleeping on the left side instead of the right can reduce those symptoms significantly because it uses gravity to keep stomach contents where they belong. So tonight, before you turn off the light, I want you to do 3 things. Check your pillow height. Is your neck truly in a neutral position, or is it being bent in some direction? Check your lower back. Is it supported, or is it sagging or arching? Check your knees. Are they in a position that keeps your pelvis level, or are they creating a pull on your spine? 3 things, 10 seconds, and then adjust whatever needs adjusting. You have spent years waking up in pain and telling yourself it is just how things are. It is not just how things are. It is a problem with a real cause and a real solution. And most of that solution costs nothing except the willingness to change a habit. If this helped you understand something about your body that nobody ever explained before, share it with someone who needs it. Because the person waking up stiff every morning, the one who thinks this is just what getting older feels like, they deserve to know that it doesn't have to be this way.